Okay, so what's the deal with tendonitis or tendinopathies? It's a word that we've probably heard is that tendonitis. What that usually means is we have an acute inflammation of a tendon. So the tendon is really where the muscle turns into this more like kind of fibrous, collagen-y stuff that is a static tissue that then attaches to bone. So when the muscle contracts and shortens or lengthens, it produces a force, goes to that tendon, that moves the bone, right? Hopefully we all know that. If we don't, there's your quick little primer. But tendonitis is like an acute inflammatory response of some sort of like overloading or strain or something like that. However, when this stuff goes on for like weeks and months, and in some cases even years, we start moving into what we call tendinopathy, which is really just like, this is a chronic tendon irritation. Acute inflammation has kind of like a certain distinguishing factors about its physiologic process, whereas the tendinopathy, it's like, this is actually where the tissue starts to degrade over time because it hasn't been getting any like proper healing, and things are actually kind of getting worse. If it's in an acute form, that tendonitis, usually it resolves in a couple of weeks, and it's not really, it's painful and it sucks, but it usually, with a little bit of movement and some guidance, things start to do pretty well. If it lingers and goes down these other this kind of degenerative condition that we call tendinopathies, that really becomes limited. And ultimately what our tissues are supposed to do, especially our muscles and our tendons, are supposed to develop and tolerate tension. That tension in the form of force. So whether it's like really strong force or it's a very quick force, it still needs to be tolerable to whatever force we're putting through it. If we pull on it and it's painful, that's telling us that, yeah, it's not tolerating that tension very well. So we have a tissue tension tolerance problem. Say that 3 times fast. Tissue tension tolerance problem. So what we need to do, instead of going and like just totally resting it and then trying to go back and run, say like an Achilles tendonitis or tendinopathy, we're going from not doing anything to, I'm gonna absorb 3 to 5 times body weight at 750 steps per mile, and I'm gonna go for a 5-mile run. That's so much force. And of course it's gonna flare up and get all angry again. So the difference is the tissue's damaged, it's trying to heal, but it can't, and then we overload it by whatever activity we choose to do. So our job in the rehab world is to identify this, figure out how bad it is, and then try to give you staged exercises so we can build this tissue tension tolerance and allow you to get back to being able to put super high forces through that tissue so that you can get back to your athletic endeavor or whatever your activities might be. We take for granted how much force goes through, say, an Achilles tendon or a lateral elbow, like a tennis elbow, even if you don't play tennis, how much force goes through those things on just basic everyday life. Not to mention super high level sports where you're in the gym 5 to 7 days a week. Like we can put a tremendous amount of force on our bodies that it just kind of breaks those tissues down if we're not allowed to recover properly. So it's our job as your therapists, and a lot of us are strength coaches as well, is trying to figure out how do we stage you back appropriately and make sure that we allow this really good progress of tissue tension tolerance to get you back up to where you want to be and absorb all these high stress forces. So if you have any questions about that, my team and I are here. This is what we do day in and day out, and we would love to be able to help guide you back to activity, get you feeling better, moving and perform better. So give us a call.